We frequently get asked questions like, does anybody have an employee assistance program success story they'd like to share? Or do you have things that your unit does that you'd like to say, hey, we've recently started doing something this year or last year? Any stories you'd like to share with your peers? Got one right here. Joy with Jacksonville.
N63. Okay, we'd like to know how other agencies are handling their insurance premium. Like when someone starts in October, we've taken out in October for November. Well, they bill us for those October, like for family, you know. How are y'all getting that premium? Are y'all going back to the employee and saying, hey, you owe us for this period? Is that what y'all are doing? Do you wait till you get the bill and then go back to them, then you'll see what you owe, or?
Renee with Madison County.
We are date of hire, and we do the same thing. We're paying in advance. So if it's after the 15th of the month, they do not pay for that month, but they do owe for the next month, and we double up. So we double their deductions, and we explain that in new hire orientation.
All right, good question.
Yeah, back there, DC. Thank you to Joy for being here all the way from Florida, Jacksonville, Florida. Oh, there's a Jacksonville, Alabama, huh?
Sandra Sanders, Auburn Housing Authority in Auburn, Alabama. I was just to suggest that what we do to have them repay the premium, especially if they have family coverage, is as long as it's within the fiscal year, we let them spread out the payments that they owe over their pay periods, which has been very helpful, and we've been able to get our money back that way.
Your name and unit?
Auburn Housing Authority, H54.
Okay, got a question right here, Jason.
Terry Henry with Cheatham County Commission. What we do is our insurance start first day, second month. So if somebody starts in October and that means their insurance is not starting until December. So we should be able to get that premium in November, right? If they start working October, correct? So that's the way we do ours, because ours start first day, second month. So if somebody start in October, their insurance is not starting until December. So we're going to collect that premium in the month of November for December.
Thank you for sharing. What was your name, sir? What was your name, sir? Jerry.
From Chilton County Commission, HR Director from Chilton County Commission.
Oh, thank you.
My name is Glenda Jones, and I'm with North Shelby Fire District in Birmingham. We're a very small unit, and so your premiums come out twice a month. Well, 2 times a year, you get 3 paychecks. So because we're so small, I can make up the difference on that 3rd paycheck. So that's kind of how I've decided to handle it.
Okay. Good. Other questions or stories you'd like to share? While you're thinking about it, I thought I'd point out that we've really had some rock stars this morning with the presentations. And when you go back and think about, we started off with Jessica and her team and how we have weaved into the game show theme with prizes and also sharing important information about your health plan. We just got a group of people around this wall that have done a great job. Jessica, Meg, Dustin, Michelle. And so we got an afternoon planned for you too that's going to be more. Some people are going to need a big bag to carry out all of their gifts, but congratulations to all of you who have already won prizes. Michelle mentioned a little while ago the importance of the survey. And we say this every year. We really want your feedback. It's what makes us better. But this year we have an extra need. At the top of the survey form, and now you're going to have to dig for the survey in your bag. Everybody got one of these portfolios, and if you open it up, and in the portfolio behind the agenda is a survey form. Well, the regulators have asked us as your health plan to report how much our members pay for their health coverage. Well, wow, that's a challenge for us because each of you do it differently. Some of you pay a big portion of that premium and some of you pay a lesser portion. And so the survey's got boxes at the top, and if you know your unit's participation in your employees' premiums, if you'll provide that to us, it'll save us some effort that we've got. We're going to have to collect it from you anyway. And so if you can go ahead and give it to us on the survey and we take them up this afternoon, that's going to help us a lot. So I thought I'd go ahead and mention that because this afternoon we're going to take the surveys up before you leave, and you might have a chance between now and then to go ahead and start putting that information down. All right, enough of my talking. Who's got a question? Yeah.
Can you do like
Here you go. Name and unit.
Laurie Chapman, Elba Housing Authority? I was just wondering if we could do like a show of hands of how much percentage-wise most people pay on family and individual coverage.
All right, so if you're a unit that pays 100% of single coverage, can you raise your hand? Wow. All right, how about 100% of family? Okay, that's awesome. All right, if you pay between 50 and 100%, or 50 and 75% on family.
The company pays?
Yep. Okay. On family. Yeah.
How about if your unit percentage depends upon your wellness screening?
So do you penalize your employees if they don't get a wellness screening?
Yes, we do.
Raise your hand on that. Is that what you're asking, Jess? How many of you guys cover retirees? And do you guys put anything towards that if somebody wants to? If you put something towards your retirees, raise your hand. And I'm just randomly going to call on you. Renee, how much do y'all pay towards retiree?
25 years of service, it's free.
25 years of service that's free for life for Madison County. Terry? All right, so 25 years, y'all pay 100% up till they reach Medicare age? Okay, perfect. Stacy?
We reimburse back up to the maximum that we would pay towards family coverage, but our employees have to take an individual policy out somewhere else. So we pay 80% of family coverage.
Okay. Anybody else want to share? Anybody else want to share?
We vary ours based on the length of service. So, it's like an 85-15 split for 10 years of service, age 60 or more, all the way up to 100% paid for 30 years of service.
So what we see with your health plan is how each of you as units use it to help attract and retain employees. And it's a key factor in the benefits we can provide as governmental entities to our employees to help keep them working for us. And today, in today's world, that's even more important than it's ever been. It's harder and harder to find good help and then to keep them. And so we're proud to be a part of how you provide great benefits to your employees. Other questions? Yes, right here.
Name and unit.
Laurie Harris, Montgomery Area Mental Health. We are trying to up our efforts to get to the preferred rate, and we struggle with that severely. I would like to hear what some of the other units do to educate their staff on how this would help them in their pocket if we could get the preferred rate, getting their wellness screenings every year. So what are some things that you guys do to get your employees to attend the wellness screenings? We've even offered cash incentives and can't get enough people to come into the screenings.
Okay, the question really is, how do you get your employees committed, engaged? How do you get your employees to participate in the wellness screenings so that you can get that preferred premium structure? Got one answer back here.
I don't want to be ugly, but we kind of just bluff them and we say it's absolutely required.
And your name and unit?
I'm Tammy Edwards with Greenville Waterworks in Greenville, Alabama. We make it mandatory. That's what we tell them.
Sandra Sanders, Auburn Housing Authority in Auburn, Unit H54. We pay currently for the employees 100% for the individual coverage, but we pay 75% of the family. So what we do to get them to participate in the wellness is we tell them if they want to continue being able to have that percentage paid by the company, they have to do that as well.
Yeah.
If you want to.
With us, we also, it's not a mandate, but strongly encouraged. But we pay 100% of single coverage, and family only pays $304.50. Okay. So if they want to maintain those savings, they have to participate.
Okay. That's fine.
We pay 100% of all coverages, but we have an incentive of $1,300 a year out of pocket for each employee that turn in. If they pay like co-pays or anything like that out of pocket, they can turn in those receipts and we can write them a check for that amount. And they have up to $1,300 to do it. If they do not participate, then we take that away.
We got somebody back here.
Janae Burrows, Mobile County Commission. We charge the employees a $50 surcharge if they don't have their wellness screening.
So a $50 surcharge if they don't take their wellness screening.
Is that one time or free?
Is that once? One time?
Once monthly.
Monthly. Monthly, okay.
Yeah.
Baldwin County Commission, the same thing. So we actually offer our employees wellness certificates for participating. They get a half a day off of work.
Wow. That's a good positive incentive.
So let me jump in here. All of these are great ideas, but the lawyer in me can't let this go without at least stepping in and reminding everyone that there are a lot of federal rules and regulations regarding wellness screenings and wellness participation, and that it has to be voluntary. And there was actually a set of rules that was passed 4 or 5 years ago, and those rules were subsequently overturned by the United States Supreme Court, and there's not been any new rules given. However, those rules are kind of the guideposts that we have to go by. And on the financial side, I think the standard was around 30%. It can't be more than 30% of the total cost of coverage, and it would be voluntary at that point if it's less than 30%. But I would strongly encourage everyone to talk with your own counsel when developing these rules.
And if I was smart, that's all I'd say about that. But I'm not the smartest tool in the shed. I'm going to say a little bit more in just a minute.
Yes, ma'am.
I believe it. I don't know who it was. One of y'all said that y'all gave $1,300, up to $1,300 a year. I was just curious, like as far as what he was alluding to, like the HIPAA laws on the receipts and stuff they turn in, if it's showing that they, paid so much for Viagra that month. Yeah.
We have general counsel on staff as well.
So what did you say?
I said we have general counsel on staff.
So how do they report it to you? It just doesn't show.
They're just turning in the receipts that shows the dollar amount. We have to know that it comes from a legitimate doctor's office or something like that. As long as it says that, then yes, we can reimburse.
All right, so for those that couldn't hear in the back, so they just have employees turn in the receipts with the dollar amounts, not with any HIPAA information or anything like that on it.
So let me stay on that wellness topic for a minute. And maybe it's because I've got a lot of gray hair. Maybe it's because I've got 4 kids. Maybe it's because all my life I've been trying to get people to do the right thing. And I tell my kids, the choices we make today have consequences later. And our whole focus on wellness, if you think back to David's presentation this morning, and he presented our mission statement, and it was to provide a best-in-class, affordable health plan, and to focus on improving the life and well-being of our members. And those things are joined. And so when I think about selling to our employees and our members the value of wellness, and Jessica could do such a better job than me with this, but when I go to my doctor once a year and he does a blood screen and says everything looks good, Rob, I have to own my health, and I have to do the things that help me know am I healthy or not. And these wellness screenings give just a little snapshot insight to something that you might not even know is going on. Whether it's, well, my blood sugar's a little high this year, it was a little high last year, or my cholesterol's a little high, or my weight's on an upward trend. And so these wellness screenings put control of my health in my hands. And if I can find out something early, anything I can find out early, we live in a country where we have the best health care in the world. And if I can find out early, I can be treated. If I find out late, it might be too late sometimes. And so I've always tried to tell my kids, do the right thing early on and it'll pay dividends down the road. I think with our wellness program, if we can convince our members that you're making an investment in your health and it's keeping your premiums low on the health plan side. If we can find something soon and treat it, get it under control before it gets to be a big health issue, then it saves money for your health plan and long term helps us keep these premiums stable and predictable over long periods of time. And so,
Does anybody else want to incriminate themselves on camera about their wellness incentives?
I got a question for Chris.
This is Terry again.
Okay, back on the wellness screening. What if we add that into the job description and one of the requirements, like we do, hey, you must do a drug screening, you must have a valid Alabama ID, and we add that into the job description. Well, on our job description, we can't do that. That's not legal either. That says, hey, you got to do wellness screenings are required. We don't do that. I just ask.
No representation is made that the quality of Chris's legal services are better than the other.
I would advise against that, but I would also suggest that you talk with your lawyer about that.
I think it goes back to what you said is education, and I think that's what I just got to Madison County about 2 months ago, and the education level that they take on with their employees is it starts with the new hire orientation, talking about that, talking about wellness screenings that we do it every year, the time of the year that we do it, communicating for social media. We're talking about it throughout that as well. We're telling them the reasons why we should have that done and the benefits to them as long as the county too, to keep our rates low. So, and then we personally, just the last couple months, call them when they're not getting it done. Hey, listen, and all of us take a group of them and we call as many people as we have to get it done. So it's just education and keeping up with them and being in their face to say, hey, listen, this is important to you and to our county.
thank you. And so the last thing I'm going to say about wellness is we've had a program where we've been very successful. You have in getting your members to participate in wellness screenings, but we've got a gap here. And Jessica mentioned it in her questions this morning. How do we get the spouses engaged? We're only getting half of the equation covered here. And so we're getting my screening done, but I'm not bothering to tell my wife, hey, you can get the screening done free of charge. And I have to believe that there's benefits in doing it in order to get her engaged. And so you're going to hear more and more on that topic of how do we get spouses engaged? How do we bring them to the table? Because we believe that there are real benefits in these wellness screenings. And if you believe that too, we need your help in getting those spouses screened and putting some emphasis.
Does dependents come too, like your children?
Children, our focus is going to be on adults, on employees and their spouses. Children don't have the same, while not all children don't have the same health risk, the risk we're looking to manage really fall within the adult realm. Okay, good discussion. Any other questions or issues or things you'd like to ask of your peers or of Chris?
We were just discussing that we have to have our budgets done before we get the premium. So is there anything that can be done about that? Or I know it is dependent upon when y'all have y'all's board meeting. So I was just asking that question. Oh,
It's a good
Anderson.
question. And we get asked that, I'm sorry.
June Anderson with F11.
June Anderson. It's a good question. We get asked that frequently, and we have talked about how early in the year can we get enough financial data to predict what it's going to cost next year. And so the shorter we make that period of time, the less accurate we are. And so there's a balance, a fine line between looking at 8 months worth of data and figuring out how that trend projects into next year, and bringing our board together to share with them all of that data. And so, for example, we're seeing pharmaceutical drug cost trends are going up at a double-digit pace. I'll just leave it at that. And so we're trying to get as much data about that as we can before we try to map that out to what is the premium got to be next year. And so we hear you and we understand it because we have to go through budgets too. But we're trying to strike that balance. Dustin, is that fair?
And Rob, I'll take that as well. You're exactly correct in everything you said, but we will, starting next year, we're going to try to have the board, excuse me, the board meeting at least a couple of weeks before this year. So we're going to try to get those numbers to you by no later than the first week in September at the latest. So.
And that's why he's the CEO.
And that's recorded, right?
My question on that, is there a good percentage to use when working on my payroll forecast, just to make sure that I kind of encompass these increases that we get? Is there a good number?
We typically tell units, Teresa, keep me straight here, 7.5%, just bank on that before the rates are finalized each year. We try as hard as we can to come in lower than that, but that's the number generally before the number's in, we tell the units to shoot for.
In the very back here. Dustin or Jason in the very back of the room. Ryan, Jason.
And keep in mind, when you do get these slides, David had that excellent chart that shows the history of our premiums going all the way back to
93?
93. So you could, it's not written in stone. Get with your accountant and see if, yeah, there you go. I'm going to shut up now.
My question is, do you ever anticipate utilizing an online enrollment cancellation or changes system? Yes. And if so, how soon can we expect that?
Yes, and not soon enough. So I said yes, and not soon enough. And so David spoke this morning to our commitment to embracing technology and providing a greater service to our members. I'm going to talk a little bit more about that later this afternoon, but as many of you know, we're separating from the State Employees Insurance Board, and we've been in a process of doing that for some time. And we're using the technology that the State Employees Insurance Board has built for their own use for decades. And for us to move to a different platform will take some effort to get there. We are contracted with a firm called Benefit Focus, and David mentioned them this morning. Our Benefit Focus would like it to take about 12 months to get there. We believe it's going to take about 15. That's not a commitment yet. We're planning our project right now. And so this time next year, I'm going to have some really crisp information about what that's going to look like. But I'll show a few slides at the end of the day of what it's going to look like. But you know, my kids won't sign on to a computer terminal. They won't use a piece of paper. They don't have a checkbook. They want it right here. And it's going right here. It's going right here for a member to be able to, when they have a qualifying life event, a birth of a child, take a picture of that birth certificate and register it right here. Goes to the unit to approve and comes straight into us. And so that's where we're going. And I know we won't get there fast enough, but there's some exciting times ahead of us, and it's the commitment of the team on this wall to get us there. Thank you. But there was a question in the very back.
What is the impact of COVID in that number that we saw from local government?
The impact of COVID on the rates this year, the 6.4%. COVID played a factor in those, obviously. COVID did play a factor in our claims since 2020, obviously. That was taken into account when we came up with that 6.4% number. And I will say, keep in mind, the board members are members of the local government health insurance plan as well. So they are very cognizant to keep the premiums as low as possible. David, did you have something else?
No, just excuse me. No, just from an actual claim standpoint. Early on in the pandemic, I mean, and Dustin, you'll know this better than I do, but I mean, we were incurring a couple of $1 million a month. Would not be unusual in COVID-related expenses and claims. That number has consistently dwindled down over the years, and now, what, Dustin, we're $250,000, $300,000 each month, maybe a little bit more than that. In COVID claims. So we've seen a great decrease in the amount of actual claims applicable to COVID. So hopefully that continues. Hopefully there won't be another spike. And a lot of these vaccines have helped, and just member education has helped. So we're seeing less and less of an impact financially on the plan from COVID.
And I will say we did receive some federal reimbursement funds, not this fiscal year, but the previous fiscal year. So we were able to keep rates down a little bit more last year, but since then we haven't received any more federal funds for COVID.
But then, Renee, you know, like the rest of us, there are other consequences of that pandemic. And we saw people early on not getting some of the care that they needed when they needed it. And when you put things off, sometimes other conditions get a little worse. Maybe you didn't have the diagnostic checkups that you needed. Maybe something was caught a little later. Maybe there's some catch-up time in getting people back to the same level of care and health they had prior to us shutting everything down. And so there's a little bit of a wild card here and some things that we still don't know about what the long-term implications on our public's health. But hopefully we have the COVID numbers knocked down and under control. We visited with Blue last week, and they told us that there were less than 100 hospitalizations statewide for COVID last week, when at its peak there were 4,000. And so that just tells you that hopefully it has run its course.
So everybody, please get your flu shot so we don't have flu expenses coming.
Great discussion. Great discussion. One last question from anybody. Right here.
Is there any plan to go to like a tiered premium?
Another excellent question, one that we hear not very infrequently. It's something that we're going to look at. That'll be up to the board to determine if that's something that they want to do. But that is something that Dustin and I are going to look at this year, and potentially, it may come up before the board at some point in time.
All right. Thank you all for that great participation. Give yourself a round of applause. We got.